Before using Humira, CF, Syringe Kit, it is important to read the medication guide and instructions for use provided by your pharmacist. If you have any questions, ask your doctor or pharmacist for clarification. If you are using this medication at home, make sure to learn all preparation and usage instructions from your healthcare professional and the product package. Before using the syringe, check the product visually for particles or discoloration. If either is present, do not use the liquid. If you are removing this medication from the refrigerator, leave it at room temperature for 15 to 30 minutes before injecting. Do not warm up this medication any other way, such as by heating in the microwave or placing in hot water. Before injecting each dose, clean the injection site with rubbing alcohol. Change the injection site each time to lessen injury under the skin. New injections should be given at least 1 inch, 2.5 cm, from an old site. Do not inject into any areas of the skin that are sore, bruised, red, or hard. Use this medication exactly as prescribed. Inject this medication under the skin on the thigh or abdomen as directed by your doctor, usually every other week or once a week in some cases. The dosage is based on your medical condition and response to treatment. In children, the dosage is also based on weight. If you are using this medication to treat psoriasis, hidradenitis suppurativa, Crohn's disease, ulcerative colitis, or uveitis, your doctor may prescribe a different schedule/higher dose at the start of your treatment. Carefully follow your doctor's directions for using this medication. Learn how to store and discard medical supplies safely. Use this medication regularly to get the most benefit from it. To help you remember, mark the day on the calendar when you need to receive this medication. Do not increase your dose or use this drug more often or for longer than prescribed. Tell your doctor if your condition lasts or gets worse. If you experience redness, itching, pain, or swelling at the injection site, contact your doctor or pharmacist. It's important to remember that the benefits of using this medication outweigh the risks of side effects. However, be sure to inform your doctor immediately if you notice signs of infection, such as a persistent sore throat or cough, fever, chills, or trouble breathing. Additionally, seek medical help right away if you experience symptoms of liver damage, such as nausea, vomiting, loss of appetite, or yellowing of the eyes or skin. In rare cases, this medication may cause a serious allergic reaction, so it's important to seek medical help if you notice any signs of an allergic reaction, including rash, swelling, severe dizziness, or trouble breathing. If you experience any other effects not mentioned here, be sure to contact your doctor or pharmacist. Before using the Humira, CF, Syringe Kit, it's important to talk to your doctor or pharmacist about any allergies you may have. This medication can contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have had recent infections, blood or bone marrow problems, seizures, certain brain or nerve disorders, cancer, heart disease, or lupus. It's important to be aware that this medication can increase your risk of infections or make current infections worse. It's best to avoid contact with anyone who has a contagious infection, and to talk to your doctor if you have been exposed to an infection. It's also important to let your healthcare professional know if you are using this medication before receiving any immunizations or vaccinations. To lower the chance of getting injured, it's important to be cautious with sharp objects and to avoid activities that may result in injury, such as contact sports. If you have surgery planned, it's important to inform your doctor or dentist about all the medications you are using. Older adults may be at greater risk for infections and cancer while using this medication. If you are pregnant or breastfeeding, it's important to discuss the risks and benefits of using this medication with your doctor. It's important to be aware of potential drug interactions that could affect how your medications work or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not make any changes to your medication dosage without your doctor's approval. Some products that may interact with Humira, CF, Syringe Kit include other TNF blockers, such as etanercept, infliximab, as well as other drugs that weaken the immune system, such as abatacept, anakinra. Be sure to discuss any potential interactions with your doctor before starting or stopping any medications. Remember, it's important to follow your doctor's guidance for the best results. If someone has taken too much Humira, CF, and is experiencing severe symptoms such as fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222. If you're in Canada, you can contact a provincial poison control center for assistance. It's important to remember not to share your Humira, CF, syringe kit medication with others. During your treatment with this medication, your doctor may need to conduct lab and/or medical tests, such as complete blood count and liver function tests. Be sure to keep all of your medical and lab appointments, and consult your doctor for more information. If you forget to take a dose, consult your doctor or pharmacist for a new dosing schedule. Do not take a double dose to make up for the missed one. When storing your Humira, CF, syringe kit, it's important to keep it in the refrigerator, but do not freeze it. Some brands of this medication may also be stored at room temperature, so be sure to check with your pharmacist or read the product package to see if this applies to your medication and for how long it can be kept at room temperature. Once the medication has been stored at room temperature, it should not be put back in the refrigerator. Keep the medication in the original container to protect it from light. Make sure to discard any unused portion of the medication and keep all medications away from children and pets. When it comes to disposing of your medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed, and you can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.